Good morning, NABJ. Thank you, President Dorothy Tucker, board members, and staff members for all that you do. Gathered at this convention are Pulitzer Prize-winning investigative reporters, podcasters, and photojournalists, and ambitious young students ready to wield the power of the pen. Whatever your story, it is clear that NABJ members are united in purpose. You are surpassing the bar for journalistic excellence, breaking stories and providing analysis on the most pressing issues of our time. You are on the forefront of the fight for diversity in the newsroom, and you are preparing the next generation through your scholarships, your fellowships, and your training programs. And you, as members of NABJ, always speak the truth, even when it is difficult to hear. Thank you. Fueling this important work is an equally important principle, a principle that the President and I believe in deeply, a principle that our nation was founded upon. That is, of course, the freedom of the press. A free press is essential to any democracy, and the reason, of course, is simple. A free press ensures that government is held accountable to the people, reveals truth to the people. To borrow the words of that great journalist, Ida B. Wells, the way to right wrongs is to turn the light of truth upon them. Well, NABJ members, you turn the light of truth on some of the most consequential issues of our time. For 18 months now, you have shared the facts about the COVID-19 pandemic and the science around it. You have been a reliable source about the anti-voter bills that have been introduced in state legislatures across our country. From the front page to the business section, from local papers to international broadcasts, you are keeping the American people informed about all of the issues that impact their lives every day. There is not an issue in our nation that Black journalists do not cover. As many of you know, my mother was a scientist, and she taught me the importance of investigating, of finding the facts, of challenging assumptions. Well, I see that same diligence and persistence in the work you all do every day. You are professionals, and in so doing your work, you dig deep. You uncover what has been hidden, what is being ignored, what is unjust. You tell the story, and you shine the light of truth. So on behalf of our nation, thank you all for what you do every day. And please know that the President and I are committed to defending the freedom of the press in the United States and around the world. Thank you again, and enjoy the convention.
Hi, I'm Dr. Ian Smith, author of many New York Times best-selling books and a TV personality, contributor to the Rachel Ray Show, but I am least important in this conversation. I'm very excited that NABJ has asked me to moderate this extremely important conversation, so thank you for that. I look a little blighted. I'm coming to you from a safari in Kenya, so please apologize for my attire, but this conversation was so important for me that I want to do it all the way from the bush. Joining me are two gentlemen who need no introduction, and rather than waste time going through their extensive and very impressive bios, I will let you read that online, but Dr. Anthony Fauci joins us. You all know he has been instrumental in leading the country's COVID-19 response, and Dr. Cameron Webb also, who is working with the White House on a bunch of roles, including health equity and dealing with COVID also. So I'm not going to waste any time going through the bios, but what I would like to do is like to have a very nice conversation about what we can do addressing communities of color and those who are underserved. Let me also start by saying that in lieu of time, we're all physicians and doctors. And so if we could call each other by our first name, if my fellow doctors don't mind, It seems to be easier to do that. So let me start with you, Tony. Before we get to where we are now, I'd be remiss if I didn't go back a little bit to the beginning of the pandemic, and talk to you about how I always believe that mistakes are the best lesson points. And certainly a lot of mistakes were made earlier in the process. We all agree. This is something we've never experienced before. By the way, Tony, I interviewed years ago when I was a cub reporter for NBC Nightly News, doing an HIV story. So it's good to see you again. But Tony, we know how viruses work, and we know the dangers that come with viruses. Where did we get off track in the very beginning? And looking back, what could we have done differently to prevent us from being where we are now?
Well, Ian, there are a lot of things. It's a very complicated situation, but some of the things I think people need to appreciate, that when you're dealing with an entirely novel situation in which you've really never had experience like this before. We've dealt with viruses before, HIV and Ebola and influenza and all that. But when this was thrust upon us in the very beginning, there was the evolution of information that kept on changing understandably. First, we thought it was jumping species and didn't do very well from human to human. Then we found out it did do well from human to human. And then we found out that it was very, very highly transmissible. And then the thing that really was different, that when you say what mistake, technically it was a mistake. But since we didn't know what the data were, you can argue what the definition of a mistake is that we know now that 50 to 60% of the transmissions occur from someone who is either completely asymptomatic and will never get symptomatic, or someone who was pre-symptomatic. So even though everyone was going on the influenza model, this completely exploded the influenza model, in which you have some transmission that might be person to person who would be without symptoms, but not 50 to 60% of it. So community spread was spreading while we were trying to figure out wear a mask, not wear a mask, shut down, not shut down, do physical distancing. And as we were doing that, the virus was spreading among us. So if there was anything that if we had to go back and do differently and knew about the incredible capability to both transmit as well as to do it in a very insidious way, we probably would have called for things, Ian, that now thinking about it likely would not have been accepted by our society. Because can you imagine me getting in front of the TV and saying, okay, we have one documented case and we have a few that we think are community spread. A, you got to shut down the country, and B, everybody's got to wear a mask. They would have thought I was crazy. But retrospectively, Ian, it was a mistake not to do that.
Yeah, it's interesting that you say that. I remember in the beginning, my wife and I had been to Japan a couple of years earlier, and everyone in Japan, this is pre-COVID, by the way, but people in Japan wear a mask all the time. And my wife said to me when COVID struck, she said, people just aren't going to wear masks. That's just not, Americans just are not going to do that. And we were thinking about how the Japanese do it even without a pandemic. So yeah, I understand that it would not have been acceptable on many levels, especially given what's happened now, which Cameron, someone who has been at the forefront in many different ways, it's been quite frustrating for me as a physician and a man of science to see how people have behaved and reacted to something that is purely a scientific phenomenon. The politicization of it, people who are fighting over it, making it something that it's not. From where you have sat and where you sit now, how do we move the ball down the field and get away from the politics of COVID and get into the business that the three of us know is important, which is protecting and serving and treating and helping our communities?
Absolutely. Well, as they say, nature abhors a vacuum. And I think the absence of some information, both early on in the pandemic and that's continued throughout, is that vacuum. It's that gap in understanding that creates opportunities for mis and disinformation, to get in and to confuse, conflate, and confound. And I think that's one of the big things that we've had to contend with throughout this pandemic. We've had to really watch and engage. We've had to hear and learn what's happening in communities, what people are hearing, and then not only work to undo the mis and disinformation, but then share the accurate information and additionally, as it evolves. You know, if you're watching this science has evolved over the last 17 months. And so, you know, as Dr. Fauci just mentioned, you know, as he's, you know, making recommendations, we can look back with the retrospectoscope and say, oh, we should have done this or that. But at the end of the day, at the point in time where you are, you have the science as you know it today. And that could very well change tomorrow. So I think that our goal at this point really has to be to stop, to engage communities and say, this is what we know, this is what we don't know. Let me hear your questions and I'll answer them with the current understanding of the science. And I think, you know, it may be a little idealistic, but let's agree upon this idea that, you know, entities like the CDC are going to bring you the best science as it comes to us. So we need to look to that as our true north. I think really that's really been one of the challenges, is getting people aligned on where the science really is.
You know, Tony, it's been very hard for me to watch as a journalist, as a doctor, as a scientist, someone who cares about other people. It's been hard for me to watch you getting pilloried over this last year and a half when you were just speaking basic scientific facts. I say to all the people I talk to, listen, any second-year medical student who's taken virology can understand how viruses work and what you probably should and shouldn't do in a pandemic, but you've been taking a lot of hits. And so what I want to ask you, and that people think that you are the face and name and voice of the country's pandemic response, and you're not. You are part of a team. And it's not just what Dr. Anthony Fauci thinks, and all of a sudden that's the rule. Can you kind of help quickly explain kind of how it works behind the wall, how the decisions are made, who decides, or how the team decides what to communicate, just to explain to people that it's not just you sitting in an office just making decisions whimsically?
Well, I'm glad you brought that up, Ian, because that is really one of the things I think that, as Cameron said, those who want to be mischievous can actually, you know, get a situation where you need a target. And the target can't be the entire biomedical research and public health group that are thinking about this, worrying about this, sweating about it. What I have done is, I'm a scientist. I'm the director of an institute that's responsible for research that led, quite frankly, for the most part, to the development of the vaccines. Yet somebody needs to be the villain. And we are in a highly politicized area. I think anybody who knows anything about what's going on in the United States, it's unprecedented in the misinformation, disinformation, conspiracy theory, and whatever it is. So all of a sudden, people of a certain bent want a boogeyman. And that's me now lately among the very, very far radical QAnon right, whoever they are. And it becomes taking it directly out of the realm of public health. You're right. I'm part of a team of public health people, of epidemiologists, of scientists, of vaccinologists, all who have one goal in mind, is to preserve and protect the health of the people of this country and indirectly of the people of the world. And when you start putting politics and characters and boogeyman and crazy things that go on, it just distracts from the process that's a very sound process that has nothing to do with politics at all, nothing at all to do with it. And yet politics have been thrust into this, which, as Cameron says, completely clouds what the truth is. I mean, if you have disinformation, misinformation, when you have a changing scientific terrain, which naturally has to change, that's a perfect setup for people to say, these doctors, these public health people have no idea what they're talking about. All you have to do is thrust in there some fantasy, some lie, if I might use the fact that it's the truth. You know, there's a lot of big lies going on out there. This is one of them. When they say that, you know, somebody, you know, made it up, it's a hoax and there's nothing to be worrying about, and don't get vaccinated because vaccines are not good, masks are bad. It has nothing to do with politics. It should be all public health.
Cameron, what to some degree, I understand the vulnerability of people. They're confused, they're not trained in science, and people don't understand that basically science changes. Science is not always linear, it's not always black or white. Something can happen today that may change even tomorrow. That's just science. It's not our opinion, it's how science operates, which is why I think the three of us have loved science for so long, because it's so unpredictable and it's so tough at times, but it's very fun to try to figure it out. It's like a puzzle. One of the biggest puzzles, Cameron, is how do we get the message out better? Here we are, tens of millions of Americans still need to be vaccinated. We're gonna probably need a booster shot, so we're gonna need more shots in arms. Lambda is on our shores, the Lambda variant. This is, let's be honest, this is not going away anytime soon, despite all of us wanting it to go away. So we now have to figure out, how do we communicate this message to particularly underserved and minority communities who were not getting vaccinated at the right rate, they didn't have resources allocated to them correctly, even though we were misrepresented and disproportionately affected by the health effects of COVID. So what do we tell? Here we are with the National Association of Black Journalists, some of the best journalists in the world. How do we enlist these journalists, my colleagues, to help you and Anthony get the word out to try to get people to jump on board, and not just a conventional PSA? We've got to be creative and innovative in trying to do this.
Well, I think it starts with the idea that messengers matter. They really do. And we saw early on, some of the messages coming out were rooted in confusion. But as things went on, the folks who stepped in to create and craft the narrative oftentimes did have political agendas as they shaped that narrative. And unfortunately, sometimes that narrative left communities behind. We saw 3 times the case rate in Black communities early on. We certainly saw mortality was much higher, and we didn't even have the data that we needed to track what was happening. I think in this moment, one thing that a lot of data has shown us is that, we really need to see that local messengers, local physicians, public health experts, those are the folks who need to be elevated on the ground. So when you're talking to journalists, the best thing they can do is engage those local doctors, those local public health professionals, and ask them those questions. Because for the community at large, they'll say, oh, that's Dr. Webb. I know him. He's taking care of my sister. I know that he knows what he's talking about. And I actually worked in the hospital over the weekend, this past weekend, admitting COVID patients to the hospital. And none of those patients were asking me, should I use dexamethasone or should I use remdesivir? They said, Doc, let me know what to do. And that's very different than what happens when I'm, wearing a suit sitting in Washington, D.C. and I say, this is what we need to do, because again, I lose that status as local messenger. I think I have a different impact when I'm acting in my local capacity. And for a lot of providers of color, we're working closely with the National Medical Association now. We've got, Black physicians all over the country who are being interviewed by local media, local radio, local TV, and sharing their own story, their own perspective. And I think that's going to make a huge difference. It's going to start to chip away at some of that misinformation. And remember, the messages do come from the top. There are certainly some governors, certainly some leaders who aren't necessarily saying things that are founded in science. And so we need those trusted messengers to kind of cut through the confusion.
And Ian, one other thing I think is important that I have found, particularly among the African-American and to some extent the Hispanic community also, is that the reservations that they have, you've got to respect those reservations and not make it seem like, what are you talking about? Why don't you want to do it? Because their questions are absolutely valid from so many standpoints, historically and otherwise. They have questions, and as Cameron said, you've got to get the trusted messengers to answer those questions in a very respectful way, even though they may seem outlandish, some of the things that are asked. But for the most part, they're reasonable questions. And that's the thing I find most important.
We only have about 6 minutes left. You both are very busy. I've decided to help the National Minority Health Association, which is working to get more underrepresented people vaccinated. But that's just one small thing. I'm helping them as best as I can. We are moving into the fall. Schools are going back. We all want kids back in school. I have kids in school. I want my kids in school without masks. But given where we are now with the Delta variant, and given that it's affecting kids now, kids are dying, they're being put in the ICU, there's no national mandate about masks. There's no national mandate about vaccinations, Cameron. So what are we going to do? I mean, at some point, we're going to have to say that people are going to have to be vaccinated. We know that if people don't get vaccinated and this virus keeps mutating, that it's going to evade our vaccines. It's going to affect all of us. Where are we from a government perspective about saying at some point, listen, vaccines are going to be mandated or masks are going to be mandated? I mean, talk to me about the mandate that people don't want to hear, but scientifically we may need.
Well, when you think about the politicization of this entire process, I think that's one of the things that muddies the waters there, right? It makes it harder to say a federal mandate of any sort is going to be well received in the communities where we have the most entrenched, opposition to the vaccines or to masks, right? And so if there's no enforcement mechanism from a federal mandate in those local spaces, then again, you're not going to achieve any modicum of success. What's really important for us to recognize is the differential dynamics we see at a local level. And so, yes, we can say, yes, the CDC's guidance tells us that all schools, all children, K through 12, should be wearing masks. But when you have, again, political leaders saying no masks should be allowed in schools, well, that undermines that every time. And no amount of federal mandate is going to cut through that. We have to really create that groundswell of public awareness and acknowledgement. And while we see that more and more kids are getting COVID, while we're seeing, because of the increase in cases, more kids being hospitalized, well, we see nearly 500 kids have died from COVID already. So this is not insignificant. And I've got a 10-year-old and a 6-year-old going back to school next week. We want them to be safe. And so it's so important for us to just tell that story, make sure that at a very local level, you can create that groundswell, create that political will locally to drive those kind of imperatives. But our only recourse isn't local government or state government, because the business community has really stepped up. So the masks that you're seeing in a lot of communities, it's the business community who's driving that. The vaccine mandates, it's the business community, the public sector, the private sector saying, hey, we want our folks vaccinated because that's how we stay safe. Again, it's that groundswell that we're helping to provide top cover to that's going to make the difference in some of those more entrenched spaces.
Let me leave the last question to you, Tony, since we're running out of time. Here I am in Kenya. Here in Kenya, you can't go into a store without being sanitized, someone supervising you being sanitized and taking your temperature. You go on to the game reserve, sanitized and temperature. So in a country that has a fraction of the resources of supposedly one of the world's greatest powers, which is the United States, we are completely disconnected and discombobulated as far as what we're expecting people to do. Let me have you end by talking to us about, number one, what is really going to get us through this at the end of the day? And number two, what do you want journalists to cover as far as the story? What should they be covering?
Well, in answer to your first question, at the end of the day, this is going to have to be a global response to a global pandemic. And what I would really want to see is to have the richer countries of the world really do for the world with COVID what we did with PEPFAR and HIV, to essentially do what was felt to be impossible, to get life-saving drugs to most of Africa in a way that would really make them be on a par with the rest of the world and not unnecessarily die from HIV. I believe we need to do that globally because, as you said, and as Cameron said so well, unless we crush this outbreak globally, it will continue to mutate, have variants, which will then evade even the countries that have successfully vaccinated all of their citizens. My message regarding your second question, Ian, is that, again, I am so impressed, having been in this for so many decades, that the best way to counter misinformation and disinformation is to flood the system with correct information. And that's what I really would like to see Black journalists do and continue to do. Just be an expression of the integrity of your profession, because journalism is such an important part of everything we do. I mean, it's the foundation of a democracy, I believe, to get the truth out there. And the journalists are the ones that can do that. So we really need you, just the way we need Cameron and we need me and we need the scientists. We need the journalists out there essentially spreading the truth.
Well, Tony, thank you so much for joining me and our session. Cameron, I thank you both. Obviously, this is just the tip of the iceberg as far as the conversation that we need, but NABJ thanks you both. I personally, if I can do anything to help you all in your spheres, I'm here for you. But most importantly is that we have to continue to fight. This fight is not just about us as individuals. This fight is about us as the human race. And I can't overstate that. So thank you both for joining us today. And we look forward to the work that you're doing and future conversations.
Thank you, Ian. Thank you for having me. Appreciate it.
Yeah,
Thanks, Cameron.
Thanks for taking out time, Ian, from your trip. And your wife's one of my favorite MDJDs. So tell her we said thanks for lending you out to us.
Okay, I'll let her know that. I know you do her. Everyone, thank you so much for joining us for this session. Thanks to NABJ for this great plenary session. Please stay tuned because following this session is going to be a great roundtable conversation with panelists, moving the conversation further. I'm Dr. Ian Smith. Thank you very much.
Hello, NABJ 2021. I'm Steve Pickett from CBS 11 News in Dallas, and proud member of NABJ for several years. And welcome to the 2021 NABJ Convention and Career Fair for this year. This has been unquestionably a challenging year for so many people, not only in what we do for a living, but throughout this nation. Our focus today, we want to discuss some of the issues that journalists, particularly African-American journalists, have faced over the past year, covering what has been a world event, the impact of COVID-19, not only in our communities, but frankly, throughout the world. The United States, for example, is facing yet another potential crisis with all of this. As most of you all know right now, there's something called the Delta variant, its impact on our communities and throughout this nation and throughout the world, frankly, right now. What is this doing for us? What is it doing in terms of news coverage? What is the focus on the impact throughout this land? President Biden, for example, wanted about 70% of all eligible Americans to be vaccinated by July 4th. That did not happen. So here we are now with what many have called another wave. What does that mean for newsrooms? What have you been doing? What have you been seeing over the past year? Frankly, over the past year and a half now, regarding what has been not only a local, national, regional, but international story from the perspective of your newsrooms, from your pens and paper, from your social media, and from the people that you see every single day regarding all of this. Let's give you some insight right now about what we've seen.
62-year-old Curtis Sanderlin recently lost his wife to COVID. Now he too is battling to survive.
Did you get the vaccine, the shot?
Painting a grim picture of the new reality inside some hospitals, tonight the numbers from the CDC reflect our nation slowly slipping back towards crisis.
A pandemic of the unvaccinated, that's what the CDC director is calling it. And acutely, that may be true, but the effect of the Delta variant is certainly wide-reaching.
COVID disease in Dallas County is back on the rise.
3-4 weeks ago, we were down to 7 patients in the hospital with active COVID, and today we're at 42.
Out of 122 COVID-positive patients admitted into Broward Health hospitals, only 2 have had a prior shot. The wave of new cases has prompted the hospital to slide into a code yellow, which restricts visitor access.
Data shows African Americans in the city and beyond are the least likely to get the vaccine.
And I am encouraging you, first of all, if you have access to the vaccine, receive it.
Black churches like Abyssinian Baptist in Harlem are now vaccination sites and are part of a strategy to build trust.
Blacks and Latinos are more likely to die from COVID, but less likely to be vaccinated. Early vaccination data shows that Black Americans lag significantly behind white Americans. Take Maryland, where 63% of doses have gone to whites and 15% to Blacks, though they make up 31% of the population.
I'm hearing more and more stories of people coming from outside of the district into the district to take the supply, and that's wrong.
Congresswoman Natalie Barragan wants state and LA County Public Health to release the race, ethnicity, zip codes, and jobs of everyone vaccinated so far. She says the current system blocks many minority, poor, and elderly people.
We had one constituent in Southgate had to take 3 buses just to get to a site to get a vaccine.
1 in 3 Black people in America know somebody who has died from this disease. And here's the other point that I will make. Virtually everyone who is in a hospital right now because of COVID-19 is unvaccinated.
The pandemic-ravaged economy threatening to take everything.
So you were only making 10% of what you had been making pre-COVID?
Oh, yeah. It was about 10%.
Teresa got resourceful, seeking out grants and applying for a loan through the Paycheck Protection Program. And after a painstaking process, Teresa was approved for only $2,000, not even enough to cover 1 month's rent. And in the end, a laundry list of issues keeping her from actually receiving a penny.
The economic virus, also a storyline regarding this pandemic, not only in that particular community, but in city after city, community after community. Part of this discussion is to hear the voices of journalists who are part of the National Association of Black Journalists, who are at the front of this coverage. With us today, we have 4 individuals joining me. First, let me introduce Terrell Forney. He is a reporter in Miami at WPLG News 10 there in Miami. Andrea Klein-Thomas, she is a reporter for WCBS in New York City. Also joining us, Kat Stafford. She is the investigative reporter for the Associated Press based in Detroit. And Beverly White, longtime reporter at KNBC in Los Angeles. Guys, thank you so much for joining us for this conversation. Let's just dive in real quick. Every story that you just saw there is, I would submit to you, a reflection of what you've seen in your own community. What did you see on the front lines yourself? Just give us an overview of your own coverage over the past year. Let me start with Terrell.
Yeah, over the past year, I have spoken with numerous families who've been directly affected by COVID. And I can say that a good portion of those individuals have been minorities, have been Black people. I'm talking about bus drivers. I'm talking about restaurant workers, people who have not just gotten ill, but family members who have had to bury their loved ones after, dealing with COVID. And since the pandemic started, it's been an uphill battle trying to convince, minorities, at least through reporting about how important it is to get a COVID-19 shot. The vaccine hesitancy, at least here in Florida, is very real. And it is very significant in the minority community.
I know there's a specific dynamic in the state of Florida based on how the state itself responded on a matter of issues. We'll try to touch on some of those in terms of coverage. Let me go all the way out west. Beverly, talk to us about over the past year and a half. I mean, I don't think there's a larger location other than New York where you saw the real concern for people, Latinos, African Americans, and others regarding the impact of this spread. For you all, explain in terms of your coverage.
Our coverage has been challenging, just like everyone else on this call and everyone in earshot viewing this event. We can all relate to how tough it's been on the ground, not only telling these stories, but reaching the people who have stories to share. Some of our colleagues are working from home, but those of us who stayed in the streets with our long boom microphones and our masks and our gloves, we've had to go find the people who may not have Wi-Fi, but have interesting and important stories to share, especially in the minority communities where we may not have the Wi-Fi access to Zoom and share our stories through other means. So some of it's been old school, some of it's been brand new, and these Brady Bunch boxes that have now become ubiquitous to storytelling. Overcoming that has been difficult, but necessary to reach the people who have stories to share, heartache and triumph and everything in between, because the pandemic has exposed so many shortcomings in society, and it's been on us to stay laser focused on that.
The largesse of this story, period. I can't think of anything larger, frankly, in terms of its impact, not only with hospitalizations and deaths, frankly, just community fear. Kat, if I could talk to you a little bit about the primary question that was posed to me regarding the start of this is, what was your biggest challenge, frankly, covering the pandemic?
That's a great question. And I would say one of the greatest challenges was, in fact, getting people to trust us to tell their stories. I mean, you're talking about families that in many cases have lost not just one person, but I've interviewed families that have lost an entire line of people, the mother, father, grandfather, grandmother. So we're talking about an insurmountable amount of loss. And then when you couple that with the fact that people were not able to grieve in the normal ways that we do in our communities, the big funerals, people still have not been able to fully really look back on those who were lost. So we were dealing with challenges just in getting people to talk to us and how to do it in a safe manner. But I will also point out that being a Black journalist, it has been hard to cover this because being based in Detroit, this is a place that is one of the national hotspots. It was terrible for a great stretch of time. So it was hard to write these stories, in fact, about sources that I've known for years who were dying of the virus. So it's been an incredible year in terms of being a journalist and having the chance to cover these stories in a way that is impactful and truthful to what's happening on the ground in our communities. But I think it has also definitely taken a toll on those of us who have been tasked with covering it.
Andrea, in New York, as we say, it's the largest neighborhood in the world. So how much in terms of on the ground coverage in communities of New York City, where you had to go day in and day out, I presume, regarding these stories? So talk to me about your typical day covering this topic.
It just depended really, just because, Beverly talked about the logistics of it. For us, I work for the local CBS affiliate and our headquarters was shut down. So there was a time at the very beginning, we had one of the first outbreaks in the country with the workplaces right here in New York. And so when our headquarters shut down, our workflow was broken. And so LA was anchoring our shows for a while. Anchors were on the street for a while. They're in Connecticut. It just was really difficult. I was editing stories myself for weeks just to get stuff on the air. So there was a logistical barrier. But the most interesting thing to me is that I think we first started covering it as COVID, sickness, health, generally speaking, but then it became a story about Black and brown communities very specifically. It became a story about race, and not one that we had, could tiptoe around. We had to say it, we couldn't infer it. And so I live in Queens, and a lot of other people live in Manhattan, and in mid-Manhattan, a lot of people were leaving during this, but in working class communities, nobody could. They were all essential workers. They had to go to work. So we just went to them with our masks and our gloves at times, and, our long mics, as Beverly was talking about, and just really talking to people out there about how they were feeling, and just making sure that my voice in the newsroom was very much about, this is a story about race, and we need to say it's a story about race, and we need to center our stories not on just what the politicians are saying. We need to start our stories in the community and broaden it out. So that was nothing was typical, ever. Nothing was typical.
Let me just follow up, because I want to make sure that our audience gets a sense of how you felt about this as a reporter in your newsroom, because there are a lot of people who say, well, this was a pandemic that did not discriminate. And so at what juncture do you make the distinction that it becomes a story about race, if you will, and health disparities, people living and dying, that it went from being just that to even being more regarding impact on people of color? Talk to me a little bit about where that transition came for you in your newsroom.
There was one day specifically, it was in the evening, the city finally, after being asked repeatedly to share the numbers of where are cases coming from. And they had this map with just the different shades, different colors. And when you looked at that map, it became abundantly clear of where the cases were coming from, what the demographics were of those communities. And so, you could just say, we had some stories of like, the map is out and it's really showing, and then this community and that community. But then, when I saw the map and consulted with a colleague of mine, because I was still very new to New York when this happened, I had only been here for like a year and a half. And I'm like, this is looking this way to me. And she was like, you're absolutely right. And she confirmed everything. And so then I brought it to my newsroom and said, no, I really think that this is the story here. And then I did a story about how it is specifically communities of color, immigrant communities, low-income communities that are being disproportionately impacted. So you're right, it impacted everybody in one way or another, but it disproportionately impacted very specific communities. And so our line of questioning had to change. Well, we're not just getting an update on the response, we're asking why. If you have this information, what are you doing? How are you reaching communities in different languages? How are you reaching trusted sources in these communities to disperse this information outside of the traditional political structure? You know, things of that nature.
Kat, in Detroit, a year and a half ago, the concern, and stop me where I'm wrong, was the ever-growing numbers of people of color who were dying from this virus. As we transition into vaccines and vaccination accessibility, many communities here in Dallas and other places as well really focused on who's having access to the vaccine willingly and accepting a vaccine. I want you to talk about, if you will, in the Detroit area, the dynamic of vaccine availability and the willingness of people to access that vaccine. Was that a news story in the Detroit area?
Absolutely. And I would say what we are really seeing and what we have been seeing for this past year and a half now is really a convergence, I think, if you will, of a couple different things, right? So COVID-19, this pandemic, what it has done is really kind of broken wide open these racial disparities that have always existed in America, right? For centuries, right? These disparities have existed in this nation. And what we have seen now are those disparities really manifesting in a way now where, of course, we are seeing folks of color, specifically Black communities, dying at disproportionate rates, but also the hesitancy that we are seeing with the vaccine, which is for a number of reasons. You have folks who, if you think back to the start of the pandemic, who went to the hospital with their loved ones trying to get help, but they were sent home because they were not believed that they were experiencing these horrible and horrific symptoms. So fast forward to today, when these folks are asked to get the vaccine, a lot of what I'm hearing on the ground is, why would I trust this vaccine when I don't trust the medical system as a whole? So right now, the federal government, the local government, they are struggling right now to really connect with these people and get them to understand or be willing to take this vaccine. And a lot of experts are saying there's valid concern, right? When you think about, again, the medical history of Black Americans in this country, literally tested on, mistreated, misdiagnosed because of the color of their skin. So right now, that is a huge barrier in the city of Detroit. But I also want to point out that for a lot of Black communities, transportation is another issue. Just the ability to get to the site to get a vaccine. As Andrea pointed out, there are a lot of essential workers in the city of Detroit who maybe don't have the time or the ability to go get a vaccine, even if they wanted to. So right now, the question is, how will local authorities, as well as the federal government, really reach these hard to reach communities and make connections with them so that we don't continue to see the rates that we saw at the beginning of this pandemic?
Let me just follow up with you real quickly, and I'll move to the others. How was that manifested in news coverage, even from your coverage specifically, or the dynamic of making sure that those issues were on the front page of the newspapers, social media, and your local newscasts? When did it become a news story in a community such as Detroit, which frankly, whether it be Detroit, Atlanta, Chicago, DC, there's a large African-American population. So almost every story resonates on the impact of them. So when did those issues become newsworthy in your newsroom?
Well, frankly, for me, as a Black journalist, those stories have always been at the forefront. But what the struggle has been is that you're talking about one of the nation's largest Black majority cities in this country. And yet the newsrooms that are tasked with covering these communities don't reflect those same communities. So it's been a struggle at times to really see those lived experiences, those perspectives really amplified in the way in which they should be, right? So right now, you are now finally starting to see these stories stories gain the credence, gain the coverage that they deserve. But again, I guess the struggle for us as journalists is how do we also connect with readers and viewers who for such a long time feel that they do not have a reason to trust the stories that we are writing. So it kind of goes back to an earlier point that one of my fellow panelists made, which is that we have to do the work to really root ourselves in the community, to tell these stories in a manner in which that is not transactional and is not extractive, and really connect with people and give them the information that they need to make the appropriate decisions for their health and safeties of their families.
I can't think of any other journalist, frankly, in the nation that a newsroom is dependent upon their direction, their perspective, their insight than Beverly White in Los Angeles. And so I'm interested, Beverly, on this matter as we transition this year into the complete shutdown of the state of California, and particularly in LA County and other places there. When you made that transition, more vaccinations, there's a million stories there. When did it become the centerpiece of your coverage regarding Latino and African American communities on the virus impact and vaccinations?
It became anecdotal. We really drilled down to find the people, trusted sources, among them faith leaders, to talk about hosting testing sites that became vaccination sites. And then, at least in the case of the Crenshaw Christian Center, a major religious institution here in Southern California, they lost their beloved church leader to COVID. He was diagnosed at his own church testing site. Stories like that, to put Black faces on the trauma and the drama of COVID, became our baseline, frankly. You saw more diverse sources, more inclusive victims, frankly, and finally, a broad spectrum of communities where maybe we didn't do the deeper dives we should have done before. We had no choice. The data insisted we go to where the people were who were feeling the pain the most. And we all know the frontline workers at the grocery stores and the places where you cannot work from home tend to look like us. So it fell to us as journalists being responsible and respectful of the people we claim we serve to finally wrap our arms around their situations and do our level best to get it right. So it didn't take a lot of initiative or push on my part. I think we were all going in the same direction because, frankly, our lead scientist here in Southern California, Dr. Barbara Ferrer, is Latina. And she made no bones about the fact that her data indicated people who look like her, multilingual folks who may have been ignored or underrepresented before in journalism and medicine and other places. We had no choice but lean into their situations, our situations, and let people know that the pain was real. And if we're going to get through this, we'd have to do it as a society together like never before. We're not there yet, but that has become, I think, the mantra for all of us going forward is to be truly more inclusive in our coverage. We have no choice.
From an editorial standpoint, in your newsroom, frankly, was there buy-in to that? I mean, I know that every morning all these newsrooms make choices and decisions about coverage. So when did you get a sense that there was buy-in, that those issues regarding COVID or Latino and African American communities in Southern California became top of mind in terms of daily coverage?
Well, the numbers are undeniable. The science was there, like a cold slap in the face. We may not have been righteous in our coverage of these communities before the COVID arrived, before the Rona, as we like to say, arrived, but we frankly have no choice. So it didn't, I don't recall a hard shift in that direction. I just believe we had no choice, literally, because the cases that were like a fire hose of stories and circumstances and hotspots, as Andrea indicated. When you look at the maps, the hotspots reflect Black folks in LA are fewer than 10%, but Hispanics, 60, 70%, depending on your math. So we had no choice but go into those communities, bring our Telemundo cousins with us to help translate if need be, but try to get it out there, trying to save lives, frankly. This is no joke. And it's still ongoing, which of course is the heartbreaking part of it. We thought if we amplified the message of where to get the vaccines, folks would go get the vaccines and we'd be through this. But now we're talking surges. From the time of flatten the curve, it's another surge. I've lost count how many waves we're into because it just is unrelenting. And therefore, so must our journalism be. And it has been challenging, but I don't think the race-based flavor has been an issue, so to speak. You just can't deny the data. It's there. It's not letting up. And yes, Black and brown folks are feeling this to our bones. And our Caucasian counterparts and our Asian cousins and friends and colleagues have no choice but jump in. That's where the stories are. And that's what we're here for.
Terrell, in Miami-Dade area, I'm intrigued with your role on day-to-day coverage out in the streets under the climate of the rules in that particular state, which many have argued there were no rules. You didn't have to wear a mask in some regards. Talk to me about your concern about your own safety while doing this job, because everyone I know has had somebody who's been impacted by this directly.
Yeah, that has been a challenge from the very beginning when it comes to covering COVID, going out into these communities and speaking with relatives who you don't really know for sure if they've had direct contact with the person, even if they say that they haven't. In the months after, we've seen these community programs where, these organizations were giving out gift cards to families in low-income neighborhoods, and the lines would be 300, 400, 500 people long, getting a $200 gift card, and you would have to go out and cover that. How do you remain safe in that environment? The station that I work for at least put out an addendum saying that if you felt uncomfortable, just let them know, or you didn't have to at least be a part of the story. You could raise your concerns early on, but it has been a challenge. And we've had some team members to come down with COVID. But the station has at least tried to put out these emails to get ahead of the curve, in a sense. But these are stories that need to be told, whether it's someone affected, whether it is the indirect effect of someone, perhaps the PPP loans, a business that may, a Black-owned business that applied for a PPP loan and didn't necessarily get it, or anything like that just sort of needs to be told. You still have to get out there and do that, and we've tried to do that. And one final note, I will say that another challenge, even outside of the newsroom, has been access to information in the state of Florida. That was a problem also from the very beginning, because Florida is supposed to be this free and open state, but they were not forthcoming with the numbers. And that presented a challenge with trying to address what these numbers show, what the problem really is here.
For all of you all, and I just want to get a sense for all those on this panel, has there been a larger story in your world as journalists? I know there have been other events. We've all covered huge events, but I'm trying to think of a time and period where the name pandemic, the word pandemic means something. And I'm interested in how you take the coverage of this event, this devastation that's hitting the world right now. Or is it just day-to-day coverage, not even thinking about that, doing sick counts, hospitalization counts, death counts, who's got a PPE loan, where do you all see this in the Richter scale of news? Let me go back to Andrea about that first.
Yeah, I just, with everybody talking about it, I think that what makes us so different is that we're not just covering an event, even though like a long-term event, we're living it too. So I didn't realize how terrified I was, quite frankly, until my parents got vaccinated, and then until I got vaccinated. Like the exhale that I didn't even recognize how just tense I was. Because yes, I have a responsibility, but seeing New York with nobody going outside, going into Manhattan and being able to get anywhere really quickly because no one is on the road is a terrifying sight. Yes, we have a responsibility. Yes, we have a job, but this thing was scary for me. It was really scary. And I also just want to be like completely transparent with the whole idea of, centering it around race. It's not going to be, I'm sure a lot of people in their newsrooms, it was very difficult to have those conversations. For me, it felt like a risk to say it in that way unequivocally in my newsroom at the time, because at the time that there was not a culture of centering marginalized communities in coverage. So to be the Black woman and the only Black reporter dayside saying, guys, this is about race, full stop, and continuing to say it took some getting used to. What happened as a result of that was that they were like, if they got an email or something like that, they were sending it to me saying, hey, I think this looks like, stories that you cover, So what it's helped me do is really, again, I was new to New York at this time. I feel so connected to this community now after living through this with everybody else. But I also found my voice in a very different way. And it created a niche for myself and just even more of a sense of purpose, because also what's different than covering another large scale event that we're talking about life and death. I felt an extreme responsibility of how do I reach these folks? How do I make sure they get the information? We've served a lot of other people, but I'll let other people serve other folks. Let me make sure it is my responsibility. I feel like it will resonate more if it comes from me. How can I best serve us to make sure that we have the good information to make the best decisions for our lives? It became deeply personal for me, all while living through this with everybody else.
You hit on something, Beverly. Let me transition to you, essentially the same question, because you've covered the largest events ever. So is there a bigger story, and how do you, in your year and a half of covering this, balance the coverage with your own personal, everyone knows someone who's been impacted by this? How do you put that aside and cover this? I don't want to overstate it, but that's how I sense it, is that do we understand the impactfulness of the largesse of this particular issue?
I like how Andrea put it, extreme responsibility. It's like on steroids. It's why the Black journalists exist anyway. The NABJ is our North Star. It's why we got into this business, to make sure that we're not left out of the conversation. COVID gave us no choice. And then, frankly, the racial reckoning, the summer of George Floyd cannot be denied. The overlap, the intersection changed everything anyway. So it behooves us as responsible journalists in this extreme setting to take that and run with it. We're getting more Black experts on my station than ever before. We've hired more Black people than in recent memory. I think we are now laser focused on being fair and more inclusive than ever before, because these stories, again, the pandemic and the summer of George Floyd, just us being in the streets, talking to people on the perimeter at protests during a pandemic. I mean, picture that, where we'd normally be in the middle of the scrum, we've got to work the edges and peel people off to the side with our boom microphones and our masks and gloves to stay safe and still get those stories told. All of this, I think, has just underscored why we got in this business. If we don't tell these stories, who will? And now more than ever, I feel, morally obligated to take that extreme responsibility and wrap my arms around it and run with it, because it's obviously tragic. It's also a tremendous opportunity for newsrooms to do better. And I think we're able to be the tip of the spear and foment real change, real lasting change in our coverage, because COVID did not discriminate, continues to not discriminate. And if we don't get the information out there, I've heard one doctor characterize what might happen in Black and brown communities as a potential extinction event if we don't get people compelled to get vaccinated without taking sides or getting political. It's science. And if we don't bring the science to the people where they can appreciate it, we are doing a disservice. Again, extreme responsibility.
Kat, did you see at some point in your role and duty with the Associated Press the intersectionality between social justice and COVID and the dynamic of how you cover it, if there is a connection between the two on dealing with these matters of news coverage? Talk to me a little bit about from your perspective with the AP.
it's all interconnected, right? And I think that this is probably the greatest story of our lifetimes. And I say that because we are living at a time where we really had, once again, this convergence of the COVID-19 pandemic, the economic fallout of the pandemic, the racial justice movement, and so much more happening all at once. And the through line to all of what we have been experiencing has been race, has been the role of racism and that horrible legacy in this nation, right? And so we are seeing that manifest in so many different ways. And so to Andrea's point, race is absolutely the story, because we know that it is an unfortunate and uncomfortable truth that racism permeates everything in America, every single institution. And I think that COVID-19 really laid all of that bare for us in the ways in which we have been impacted disparately. And so now moving forward, the question is, and I don't think we have the answer to this yet, is what is the true toll of this pandemic? We have so many children who are without parents, so many families who are still struggling to put food on the table. And to Beverly's point, it is our role in this moment to make sure that we are amplifying those voices, that we are making sure that they are centered in the coverage, and that we are also relying on the experts of color, the Black doctors, all of these folks who have been working on the ground in these communities for so long to make sure that those perspectives in this moment are getting out there, and that the truthful information is what's being disseminated. Because to Beverly's point, this is such an immense responsibility for us right now, and we can't take it lightly.
Let me talk a little bit about the issue of the lack or the low percentages of African Americans who are vaccinated in this country. Almost every major city indicates with numbers that those who are vaccinated do not reflect the overall population of those who are eligible, particularly for African Americans. Terrell, in Miami, I mean, when you have ethnic communities of color, Haitians, Cubans, Dominicans, et cetera, how much of the coverage was focused on addressing those issues, or was it a secondary thought in terms of the editorial decisions in your newsroom about under the umbrella of COVID coverage?
I don't think it was ever a secondary decision, at least in my newsroom. I know when the pandemic started, the reality of how it disproportionately affected minorities was not really known. It was not, at the forefront of people's minds. But as we got into it and started telling the stories, there were people who noticed, like, wait a minute, something else is going on here. And I think that's how we sort of got to that realization just about how minorities were affected. In the state of Florida, it's home to 21 million people. 21 million people call Florida home. About 4 million people identify as being Black. But as of now, only 24% have been vaccinated. So there have been different organizations, different community members, city council members who may be minorities. They've joined forces with small organizations to try and get out messages. There are targeted ads in Creole, there are targeted ads in Spanish, and of course in English, to try to get to those communities to let them know just how important it is to get a COVID-19 shot.
I said earlier, guys, the concept of the economic virus. And with that news coverage, there were plenty of people here in the state of Texas who were protesting against masks, who said that stores should no longer be closed, that this was impacting their pocketbooks far too much, and that had to end. What was the impact of minority businesses under the auspices of shutdowns, and how much coverage was focused in your communities? Where should I go now? I think I need to go back to Beverly in Los Angeles.
Businesses impacted by the pandemic and the shutdown, the lockdown, you can dine outdoors, you can wear your mask indoors if you're not drinking, all of that. It's a source of great confusion and angst. And yes, our businesses are already on the razor's edge. So some suffered and fell, never to recover. Others are still trying to get that PPE money and pull through. We're not telling enough of those stories because a lot of the businesses just don't want to amplify their message. They're embarrassed. They're ashamed. It's a struggle. It's a struggle to launch a business and to sustain a business in good times. And the pandemic has kicked a lot of folks in the teeth, and they aren't always that forthcoming with what they're going through, what their struggle happens to be. They don't think it's relatable. It's on us to keep asking, seeking their permission to include them in our coverage, because we talk about the economy in general, but to drill down and include Black and brown businesses in there can be tricky. And it helps when people who look like us approach people who own businesses who look like us. And same goes for my, again, Telemundo cousins, because NBC and Telemundo are a family. We share news space. We often share resources. And my Telemundo cousins have helped us improve our coverage in that regard when it comes to Spanish-speaking communities. But in general, the economic impact, we're still not doing as good a job as I'd like to see us do. Sometimes it's about the union folks who bring up the groceries. They never had a chance to work from home. I'm trying to stay on top of that story and cultivate my sources in that community to make sure that we don't leave their drama and trauma out of the conversation. But yes, that can be a struggle when you're in a community, in a newsroom rather, where nobody knows anyone who rings up groceries, but I do. And I'm trying to be their advocate and get those stories across the finish line. So yes, it's a race and class struggle to get deeper, better stories into the newscast. But that's why we're here.
Kat, I'll turn to you in the Detroit area. Was this a storyline that resonated in terms of you guys' coverage? And how did you address this from your perspective as a journalist?
This is a major story. And, earlier I said we don't yet fully know the extent of the impact of the pandemic. That's exactly what I'm talking about. When you think about the history of Black businesses in America and the fact that it is much harder for us to obtain loans and the financing that white businesses and their counterparts are able to, we were already starting off at a disadvantaged level in some regard. And so when you wrap in the fact that the COVID-19 has closed, we don't yet fully know how many Black businesses across the country. A lot of experts that I have spoken with are questioning, what will this do? And what does this mean for the racial wealth gap that already exists in this nation? Is it going to further exacerbate it? Absolutely. We just don't know yet what extent. But another concern that has kind of emerged, at least in Detroit and other cities that I have been covering, is this concern about what is this going to do to the fabric of the community? Because a lot of these businesses have existed for decades in these cities, right? They are the places that people go to commune and gather. This is the rich fabric of a community. What happens when those safe spaces no longer exist? And so that is something that people right now are just starting to grapple with and really think about. How long is it going to take for us to rebuild the damage that has been caused on these communities that were already struggling in many ways to begin with?
We have about 5 minutes left, and so I'm going to do a quick round session here about the concept of all of us being Black journalists covering the story of the world right now that is frighteningly impacting so many people around this world, but also in your own backyards. As reporters who happen to be Black reporters, is there a distinction or difference in your coverage on the issue of COVID-19? Andrea, I think your answer is yes for you, based on everything you had today. But I want to get a sense from you individually about how you have been doing over the past year covering this story.
Personally,
yes.
To be transparent, I have increased my therapy appointments. So I go every 2 weeks now because it was hard. It was really, really hard. There was a lot of work beyond reporting, being called on in different ways because of the cultural competency that I have. So it was hard. It was very, very difficult. So yes, I'm doing well, but it's because I have, my NABJ friends that are on a text chain that we talk, all the time. But also because I seek help.
Terrell, I hearken back to a story I did here just a couple of months ago. African-American woman, about 70 years of age, who was still working at a public hospital here, who was fortunate enough to get the vaccine. The sad part is her husband and her 2 adult children were not yet eligible for that vaccine, and all 3 were dead within weeks. that stuck with me as a journalist and as an African-American journalist in particular to say that story needs to be told, and she wanted to tell it. I give you that anecdote because I want to know from you as well. Was there some place at some point where it struck a chord seeing what we've seen throughout this country and this nation over the past year and a half?
Yeah, I mean, there have been quite a few stories because, you know, you have to arm people with information, and that's the most important thing. That's the only way to really get to them. But I remember early on that there was a woman, an elderly woman, who she was in a nursing home. Well, actually, she wasn't in a nursing home. Her husband was in a nursing home, but she went to visit him. She got COVID, and he ended up dying. And you know, she seemed to have taken it very well, but her family didn't. But I think that that was the moment that sort of struck a chord with me, just on not just how serious this was, but just on how serious your storytelling has to be. And so from that moment on, especially, you know, noticing that this disproportionately affects Black people, minorities, it's trying to seek out those Black doctors, not the mayor, not the city leaders, not those kind of people, but people that these folks will listen to. So that's what I try to do.
Listen, Terrell, Beverly, Andrea, Kat, thank you all so very, very much, and for what you do every day in your communities, covering news that happens and news that we should cover because you are making it happen. So thank you very, very much. Folks, those are representatives of what happens when you have a great organization such as the National Association of Black Journalists. This story, as you all well know, is not over. It is going to come to your newsroom for your coverage as well. Reach out to these individuals if you need help, if you need guidance, but the story will be there. Thank you so very much for joining us on this day. Celebrate the rest of NABJ and this convention. We'll see you soon.